I am Megan Noleta, a nursing student from the Our Lady of Fatima University. So today we will be performing a post-mortem care for the patient. So first we will check the patient's chart for the physician certification of the. And then next I will prepare all of the equipment needed that we will be needing for this procedure. So here are all the materials. And then next, I will ask the permission and explain to the family that we are going to perform a post-mortem care. And let's assume that I already did explain it to the family. And then next, we will ask the family if they want to stay inside or outside. Now, I will provide privacy to the patient by closing the curtains and the doors. Now, I will pour lukewarm water into the basin, and I already did prepare the lukewarm water. And then now I will perform hand hygiene and put on my gloves. Now we will remove the jewelry of the patient if there are, and we will give it to the significant other. Next, we will close the patient's eyes and mouth if they are open, but our patient's eyes and mouth are closed. So now we will remove the equipment such as the linen or according to the hospital's protocol. And then now we will remove the patient's clothes carefully, not to expose their blood part. So now we will perform the advanced meditation. And then next we will put on cotton balls on the patient's eyes, nose, and upper lip. And then now we will secure the patient's jaw. Then next we will put on diaper, underwear, and clothes to the patient, and let's assume that we already did that. And then now we will give the family option to view or not and accompany them. And then next we will encourage the family to say goodbye to their loved one. And then next I will ask if they would like to be alone to give privacy. Then now I will apply name tag on the patient's hand. So now I will cover and secure the patient with a shawl. So now we will secure another name tag on the patient. And then now we will transport the patient to the market. And then we will now perform hand hygiene and remove our gloves. And that's all. Thank you.